You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, same-day crowns. New technology allows for patients to go in and on the same day get a crown made. With us, we have an expert on the topic, Dr. Blatter. Dr. Blatter, welcome to the program.
Thank you for having me.
Now, before we get into today's topic, for people that don't know you, tell us a little bit about your practice, who's your typical patient, what are the procedures you do?
Randy, I have a general dentist practice, and I love general dentistry. And so my patients range from 3 years old as their first visit to 95 is probably my
95,
oldest.
okay.
Yeah, and I love my 95-year-old. She's the sweetest little lady.
And the procedures you do in the practice?
We offer a wide variety of procedures. We do all general dentistry that you would expect to have at any general dentist office. It would be, anything from the cleanings to fillings to crowns to root canals. But then the things that I really like to do is I like to do more extensive dentistry. I'd like to do the smiles. I'd love to do the dental implants and replacing teeth. And then the topic for today is obviously the same-day crowns.
Same-day crowns. So you do dental implants. You do a lot of cosmetic dentistry as well.
Yep. Yes. The other things that we do Invisalign a lot in our office. We do a lot of smile makeovers, a lot of veneers, a lot of cosmetic dentistry. We do dentures. A lot of.
Do you make dentures as well?
We do make a lot of dentures, and the dentures that I think that are the funnest are the dentures that we can attach to the dental implants, because the dental implants help hold those in, and they are just wonderful. We do a lot of laser therapy for periodontal disease as well. My hygienists are trained and certified in the laser, and really helps keep our mouths healthy.
And lasers are hot right now.
They're
in
very
dentistry.
Absolutely.
But still, very few dentists I have found in researching
yes.
that have the lasers.
I think a lot of
So you use them just for gum disease or other things?
No, we do them for other things as well. Other treatments. Anytime we need to remove a little bit of gum tissue, we'll use them. And I use it a lot for that, for my cosmetic smile design, for sure. And, a lot of dentists are reluctant, I think, are a little nervous about technology and implementing that into their office. And I'm not that. I'm not the guy that's nervous about implementing dentistry. When they first come to my office, they'll get the digital radiography, which is 50% less radiation to all of us. That's wonderful. What a great...
And everybody doesn't have that these days?
They don't. I mean, we're moving more towards that, but there's a lot of people still reluctant. Intraoral camera, where we can take pictures. If I get to see it, you get to see it as my patient. And I can tell you about a crack all day long, but when you see that crack in the tooth, man, it makes a really
So you put a camera in their mouth.
Yep.
And then you just see it right there?
It pops
at the
up
chair
instantaneously,
or in the same room?
Instantaneously on my TV. We have TVs in every operatory as well. And so they'll get to see everything that I get to see. And I like that. I love that because it really helps you understand what's going on in your mouth. And until you understand what's going on in your mouth,
So in the old days, before you had this technology, you would have to tell them about a crack, and they say, "Oh, we'll wait."
Yeah.
But when they see the crack,
they're ready to go. They're like, "I don't want that thing breaking," because that's what we face all day.
Because you were always warning people before.
Sure.
You're a dentist, so you probably think that the smile's pretty important.
It's the most important thing, Randy. What else is there?
Okay.
Yeah, but there's studies that show that when we smile, we release endorphins, and that those endorphins will cause us to be less stressed. And we all know that we're very stressed people in society today. And if we can release those endorphins, we start to feel better. And when we feel better, our health is better. And we are really seeing in dentistry a huge change in the paradigm of the mouth really does affect the rest of our body. From the infections from periodontal disease and gum disease that gets into our blood and can lead to stroke and diabetes and heart attacks. Those are three major things that we are finding strong correlations to our mouth. And then when we smile, it just life is so much better.
But in this economy, do you see people investing in their smile?
Absolutely. Because it's not all about having to have a full mouth smile. It's not about having to have full veneers, Randy. We can do little things that really make a difference. Let's just take a $300 whitening procedure.
All right.
It doesn't take that. It takes us an hour and a half in our office. You go home with some custom trays, and you have now provided a sparkle that gives you that advantage when you go.
You say a white smile's a young smile.
Absolutely. I think that we all want to be youthful, right?
Yeah.
Do you want to be youthful?
Yes.
I want to be youthful till I'm 90, and I take that very seriously. I want my patients to keep their teeth until they're 90, because that's how long we're going to live now. And that means we got to do things differently. We got to keep them whiter longer, and we can do that. And that's the great thing about the day and age.
Are the patients getting older and older that are coming in for whitening, by the way?
Yeah.
Curious.
Absolutely. I think the baby boomers are coming into a stage where they're like, I want my smile back, because they've all, baby boomers have always wanted to have be looking good, and it's not going to change. And so, yeah, we get a lot of people who come in every age group. From, I have some parents asking about teenagers. Hey, should my teenagers whiten their teeth? All the way up to 70 or 75.
I mean, if you have yellow teeth, I guess, or stained teeth, you probably feel like, I mean, if you're bothered by it, do something about it.
Yeah, absolutely. If it affects you, because then you're not going to smile. You're not going to be as happy. You're not going to release those endorphins. You're not going to be as stress-free in life. So absolutely.
You speak in terms, we've talked on the phone, in terms of transformations. That means you change their smile, and I'm paraphrasing, but it's like you change their life. Does that happen?
It does happen. It's really fun to see, Randy. I got to tell you, that's one of my favorite parts of my job, is that somebody will come in and they'll say, "Hey, Dr. Blatter, I don't like this gap," and we'll probably show some pictures later. They don't like this gap. I've had it since I was high school. What can we do about it? And we find the most conservative route to get them their smile that they want. Sometimes you don't want to do veneers because it's just too aggressive. We have to take away too much enamel, and that enamel's precious. And so we will do something that's just maybe bonding and whitening and just recontouring maybe some of the gum tissues or just some of the incisal edges that make things more even. And if we can get symmetry and evenness, however, being as most conservative as possible, that's the goal. That's where we want to go.
Do people still, do they tell you, I mean, you seem like, and I'm trying not to side with you, people need to know this in a real interview.
Yeah.
But, you seem like a likable guy, but people don't like going to the dentist.
No.
Do you hear that? Do they say that to you?
They do. I hear that a lot, especially.
Like, what do they say? How do they say it?
They're like, Dr. Blatter, don't be offended by this, but I just hate coming to the dentist. It's nothing personal, but I just hate it. And it's fun for me, Randy, to watch that new patient will come in and say that to me, and they're like, I need oral sedation, I need nitrous, I got to have all this stuff, because they're scared. And about 3 procedures later, we've done some small things for them, we've loosened them up, they're smiling more at our office, and they're like, Dr. Blatter, I don't even need nitrous anymore. That is fun to me. It's really cool because we have a lighthearted office. Dentistry, people are so scared of dentists, and we joke and we laugh and we have a good time just so that we can make dentistry and we can help people save their teeth for a long time. Because if we can get rid of the fear of coming to the dentist, we can help save their
when
teeth.
people see you, for the first time, they're highly anxious. I mean, do you see complete reversals with some patients? Where they actually look forward to going to the dentist?
Absolutely.
Because that's hard to believe, that somebody looks forward to going to the dentist.
People actually do love the dentist, Randy. I promise you they do. They really do.
Do they tell you that?
Because it makes you feel good. You walk out and your teeth are all slick. You're like, oh yeah, that was good.
That's hard to believe.
Yes, they absolutely say that. And because here in our office, we try to make it fun. We try to make it lighthearted and try to get over everything that's going on. And granted, people don't like it. I understand that, but I'm here to help get them past that.
But it doesn't hurt anymore. Is that right?
Was
that the big fear?
I think it is. And I think the biggest thing that people are afraid of is pain, just like you said, Randy. They're especially afraid of root canals. And when a patient doesn't have a swollen face or something, that pain can be totally alleviated by anesthetic. That's a great thing.
Do you do root canals?
Uh-huh.
You never mentioned that you did root canals.
I missed that, I guess.
I mean, isn't that normally they send those patients out somewhere else? So you have specialized training in that.
I'm not a specialist. Let me be clear.
Okay.
I'm not a specialist. I'm not an endodontist, but I do root canals on the easy teeth. A lot of teeth are just too complicated. The anatomy is too complicated.
Okay.
You want a specialist doing it. It'd be like going to your general surgeon to have a knee surgery. You'd never do that. You'd want to go to the orthopedist.
Good. So moving on to the topic though of today, same-day crowns.
Yeah.
How is it normally done? Because you say what you're doing is very unique.
Right.
How it's normally done, and then how you do it when somebody needs a crown.
It used to be, Randy, that you'd have 2 or 3 visits to get a crown, right? You'd have to take work off. You'd come in, we'd prep the tooth, and we'd take impressions to send to the lab so that some lab tech out there could then make your crowns. But in the meantime, while they're making it, you'd have to have something in there. And so you'd have a temporary, and a lot of times those things are sensitive, and people hate the temporaries. And I don't know if you've ever had a crown where the temporary fell off. Those are just like everything else in dentistry. It doesn't happen at an opportune time. It's a Sunday afternoon, Sunday evening. It's painful when it comes off. The dentist doesn't want to come in. And honestly, I got tired of sending my crowns out to a lab because they weren't coming back with the quality that I expected.
What, they didn't fit properly?
They didn't fit right. They didn't look like teeth. And so then what do I ask that patient to do? I ask that patient to go back to the boss and say, hey, I know I just got this job, but my dentist needs another day. Can I take another morning off of work? And it starts to get really hard for patients to constantly be coming. And so then when the same day crown machines came out, they've been out for, a couple.
But these are like $80,000 and $100,000 machines, aren't
they're
they?
even higher than that.
More than that,
more
like
than $150,000.
Okay.
Yeah, so they're expensive.
So normally labs, they're sent to these labs that have these machines.
Yes.
So you have the machine there.
I have the machine right there in my office,
Okay.
and we can scan the tooth. And
Yeah, how does that process go? Because you say you don't have to do the standard impression material.
right. And so if you hate those impressions, this is a great way to go. You have to stay open. And I put my wand in there. And
So it's a camera wand?
It's just a camera wand. It's a laser. And it's just taking pictures of the teeth. And I take about 20 to 30 pictures, and it gives me a digital model on the computer screen. And then once that's done, and that only takes about a minute and a half. And the other impressions would take about 5. And so we've already cut time down for patients.
That's gag. Yeah, nobody likes that stuff.
Everybody hates this all over. Like, I even hate it. My assistant hates it. And so then it's the models on the computer screen, and we can then, my assistant and I, go in and design that crown. And it's cool to be able to take that crown and make it from something that's kind of, I'm going to call it blobby, that I would maybe sometimes get back from my lab because they weren't trained in the anatomy of a tooth, to say, you know what, I don't like that cusp height, I don't like where that marginal ridge is at, and I don't like the, I don't like.
So those are the things that are going through your mind when you're making this tooth.
Absolutely, and
Okay.
I get to customize that tooth to exactly what I want.
In the
it to
same
look
room with
like.
the patient?
In the same room, they're sitting there watching it. They love it. They
Really?
absolutely love it. It's because it's so high tech. It's like we are really getting dentistry in the 21st century where we're at, and not back in the 50s.
Okay.
Where those other procedures.
And most dental offices, by the way, are doing it the old way. You go in, you need a crown, they send it out.
The latest that I've heard is about 10 to 20% of dentists have this, and nationwide. I really do believe, Randy, that this is where we're going.
And the patients don't know the difference. I mean, they don't know that this is even available if they've been going to the same dentist since they were 18 years old.
Yep.
So look for a dentist that does the same day crowns.
Look for them because
they have this machine.
The quality is there now.
Is it called a milling machine? What do you call it?
We call it an E4D same day crown machine. Yep, and that's just the brand name.
And they can watch it being made?
They watch it being made, and then, so as soon as we are finished designing it, and I give the final approval, we then send it wirelessly to our mill, and the mill will then computerly, CAD CAM,
That's
computer
porcelain
system.
tooth?
It's an all porcelain tooth. It's a new material. That's why I finally got it, Randy, is because of this new material. It's called EMAX. It's 2.5 times stronger than an all porcelain tooth. So the benefits of this crown are that it has no metal in it. And so you've seen those dark lines around people's crowns. We don't have that anymore. Unless
Is that right? Okay.
Yeah, it's beautiful. And it's 2.5 times stronger than the old style crowns, than the old all porcelain crowns. You get my design, not some lab guy. And plus, you only have to take off work one morning, one afternoon. And if you go into work early, that day, and you get off at, say, 2, you can come to my office, have a crown, and you never missed any hours from work. And you never have to come back. Yeah.
It's not an exaggeration.
It's not an exaggeration. It's
today,
awesome.
I'm thinking, okay, I have a dentist coming in today.
Yep.
I'm a same day crowns. So it is possible.
Very.
Same day.
Yep.
Okay, so this machine makes it, also because you own the machine. Could it be less expensive? Or it's the same price as sending it out?
It's the same price, Randy. The only difference is that you save so much money in your time off from work.
Okay.
And that's
a good point.
Time is money.
And it's a better
Everybody's time
fitting?
is
Would
money.
you say it's a better fitting crown, in your opinion?
In my opinion, I think that the bite and everything fits better, yes.
Now, we're talking about crowns in a day, but you do like same day veneers in a way.
Absolutely.
Is that right? Like same day front teeth.
Absolutely. And I just did one last week that just really excites me. I love this because he flew in from Arizona, and he had that gap between his teeth since he was in high school. He actually has some gaps on the sides teeth as well that you can't see, but he's just like, I'm tired of it. I've been through braces and these just keep coming back. And he was one of those guys that just, when he smiled, he tried to cover up his smile with his lip. Have you ever seen those people, Randy?
A little bit.
I mean,
you probably see them everywhere, right?
We see them all the time, and they cover up their smile with their hand when they go to laugh, or they kind of keep their lip down too far, and they don't show because there's something in there that they just don't like. And when they don't do that, they can't be happy. They're not releasing those endorphins on a constant basis, Okay. And so he was like, Landon, can we make them a little bit longer? I want the gap, and I don't want them long. As I looked at it, I was like, I think we can probably do that.
So what do you see when you look at that? What's your evaluation? What goes on in your head?
So when I look at that, Randy, there's a few things that are going on. It's like, how do the teeth, follow the smile line? How are we going to get rid of the gaps? What can we do with the symmetry of the gum tissues? Because those are really important in a beautiful smile. And you want that evenness on both sides. And how am I going to get that for this guy and have him come in and leave the same day with his smile? Also the other thing that I'm looking at is that they're a little flat, and we know that youthful smiles aren't flat. People, as we age, we wear off our teeth, and we don't want that. We want them back. We want them beautifully, and we want them long. And there's a certain right length to them, and then we got to make sure that we hit that right on. And so then he came in. He flew in. We had done our prep work and everything that we've done.
How does he hear about you? He's flying in.
He's a friend
from the internet?
He's a friend of mine from dental school. How's that sound?
Okay, there you go.
So he
could have gone to anybody.
He could have gone
but he knew you had the machine.
Yep. He knows a lot of dentists in Arizona that are great dentists. But he's like, I want the same day, Landon, and I want you to do it.
Okay, good.
And so he came in. And then when we look at the after pictures, you can see that how we've removed the spaces. And look at the length of those spaces or the length of the teeth and how it just follows the lip line, and it follows that perfectly on the edge there.
That's very nice.
And the gums, we've made them symmetrical on both sides, and he has been texting me.
So you had to laser the gums a little bit.
We used our laser to laser the gums a little bit, and that's really a non-event. People are like, man, I didn't even know you did anything. You don't even need to be known for that. So
he's texting you? What's he texting you
He
about?
is texting me about how I changed his life, and he's smiling all over the place.
Okay, good.
And the cool thing, why we did it then, Randy, is because he had a job interview the next day here in California. He was flying from Arizona to California the next week. And he's like, I'd like to have these done before then. I was like, I think in your situation we can do that. Now, can we do that on every case, Randy? Probably not. Sometimes we can do it, sometimes we can't. It's all based off of how does our joint and our teeth, are they functioning harmoniously? Are they balanced? And if they are balanced, we can do a lot of stuff the same day. Randy, the other thing about him, my friend, is that he had put this off for a long time. He just kept dreading it, was scared of everything that we've talked about. And then finally he says, I'm doing it. I'm ready to do it.
And you went to dental school with him?
He was a friend of mine at dental school.
In dental school?
Yeah. He's not a dentist.
But with a gap? Oh, he's not a dentist.
Yeah, he's not a dentist.
Oh, I see.
No. Yeah, no, he's just a really close friend of mine. And
it bothered him, though?
It really bothered him, yeah. And there are gaps out there all over. I mean, people chip their teeth and break their front teeth, and it doesn't have to be major, and they're wearing them down. They're too flat. And until they decide, I don't feel the same anymore. I'm a different person than I used to be. And then they start realizing some things that's happening. We do a lot, Randy, of same-day veneers for people who have chipped teeth. Minorly chipped teeth can be repaired very easily with the E4D machine.
So when you have a chipped tooth, or short ground down tooth, you could get bonding.
Yep.
Or you can get this same-day veneer.
Right.
And again, so for people just tuning in, you have the machine. How it's normally done is it's sent elsewhere to a lab.
Yes.
And
then nowadays with technology, we don't have to do that anymore. They can get that veneer the same day. Bonding's a wonderful option, Randy. It really is. And I do a lot of bonding because it's one of those little things that we can do to change our smile, which can change our life. And the bonding is inexpensive. That's why people like bonding. The downside to bonding is, though, it breaks. It can break and it can chip, just like everything can break and chip, but it breaks a little bit easier. The veneers, the same day veneers, are going to be stronger than bonding. It's going to be more aesthetic.
So these people with chips and cracks, they're all over the place in Colorado.
You don't really see them. You don't see them as a normal person, but people because we're good at hiding them.
You could spot it. I mean, you're walking out.
I can see it. Yeah, when people smile, I can tell, hey, something's bothering them about their teeth.
Really?
Yeah, you just look at them and you can just see them tense up. The upper lip tenses up, and they just don't want to show off their beautiful teeth that God gave them because something's happened. And whatever it is, something's happening. Whether it's cracks or chips or or spaces, color, something's going on.
So same day though. Okay, let me get this right. Okay, so somebody watching this, they have cracks, they have uneven teeth. With your machine, it's got to be a couple hours. 3 hours.
To do
If everything works out perfectly,
yeah,
how soon can they actually get out of there?
that's a great question. Come in 2.5 hours later for a single crown, maybe 3 hours for 2 crowns, and then only 4 hours to do a set of veneers like we just talked about when we do 4 veneers.
So they could actually go in, get all the measurements done, put the wand in their mouth to take the photographs, design the teeth. They go have lunch, they come back, and you put the crowns on.
Yeah.
Is that kind of how it works?
That's exactly how it works, Randy. And there's people all over Colorado that are just dread the whole process because they know it's long. They've looked into it. They're like, I know I'm going to have to be in temporaries. I know I'm going to have to be coming to and from the dentist a lot. The temporaries may chip or whatever.
That's a good point. So with veneers, they actually give you these temporary teeth.
Right.
Right?
You always walk out of there with a nice smile. Temporaries or final veneers for sure.
But they're like made of some sort of
It's
resin,
like a plastic material.
Plastic. So you walk out with plastic teeth.
Yeah.
Okay. So in this way, you go have lunch, you come back, or do they leave, or do they stay there for 3 hours?
You know, most people just stay there. They just hang out. They love watching us design these. It's fun.
Really?
Yeah.
Okay.
Yeah. They love watching the whole process and watching the new product come out of there. They really.
And they walk out of there with beautiful smiles. Did their friends all notice? I mean, do you get the feedback where they say, you know, nobody noticed. They just thought I cut my hair, or
the best compliment I can get, Randy, is that people say something's different, but I just don't know what it is. And they can see the people, they're smiling more. They can tell it, but I want it to look natural, so you can't tell that something is in there. And that's my goal.
Now, a lot of these crown machines, you know, anticipating your coming. I have a friend that has another manufacturer of this crown machine. He never does the front teeth. He only does the rear teeth for crowns.
Sure.
And he said, I don't like to do the... He's actually... So is it the machine is different, or it's different training to do the front aesthetic?
Different training.
Okay.
It's not easy doing those fronts because there's so many, the front teeth, there's so many things you got to look at. We've taken a lot of courses in this so that we can provide this as an option for patients. We don't do it for everybody. I want you to know we don't.
So
do it
not
for
everybody's
everybody.
a candidate.
Not everybody's a candidate for this.
Who's the ideal candidate for on the front teeth for the same day crown?
Somebody who is
Describe the tooth or the teeth.
The teeth has a little bit of wear and some cracking and some chipping or some spaces like this guy. Somebody whose joint and whole system is balanced. He's functioning just fine. He's not grinding his teeth, or she's not grinding her teeth. And those people can come in and have something done the same day with relatively low risk of having those break in the future. Now, it's those people that wear their teeth a lot and grind them a lot that we're not going to be able to do this. And
now, I'm also going to be interviewing you at length on TMJ, and people need to know you're also somewhat of an expert.
Yeah.
A big part of your practice is TMJ from migraine headaches and how the teeth come together. And so they should probably go to your website and look at that video. That won't be for TV, but you know, very interesting. Okay, so time for probably one more photo.
Let me show you a picture that somebody that the E4D may not be the best. And
E4D is the machine that makes
E4D
the crown.
is the same day crown machine because she's worn her teeth. And you can take a look at the pictures here that the bottom teeth are worn flat. And that's a patient that we need to make sure that her system is balanced. We need to make sure that her joint and her teeth are functioning smoothly and perfectly before we ever go into doing any kind of cosmetics. Because if she ground off her natural teeth that God gave her, she's going to grind the heck out of my teeth if the system isn't balanced. And
you have to fix the bite.
We got to fix the bite first, then we can move on to some cosmetics. And so obviously that's not a case that we can do same day. That takes more preparation and more work in the temporaries. But then the result is still going to be just as pretty and just as gorgeous. And
you love this, don't you?
I do love this.
What do you like most? What do you like most? The feedback?
I love changing people's lives in a way that they never anticipated. It's fun to have people come in, like we talked earlier, come in, I hate going to the dentist, until then about 2 years later, they're like, Dr. Blatter, I don't dread this anymore. Those stories make me happy.
Good.
Or people like this, like I know I've been dreading doing some dentistry here, and then they say, you know, Dr. Blatter, that was the best. I'm so glad that I did that. I wish that I wouldn't have waited. That's the thing I hear the most. I wish I wouldn't have waited so long to do this. Yeah. For her, when she smiled, she showed a lot of her bottom teeth. And so we often think that our bottom teeth don't matter on our smile. They are really important, especially as we get to be 50, 60, 70 years old. We start showing a lot less of our upper teeth, and we show a lot more of the bottom. And so we can make those look just as good as the top, and then everything. And as long as everything functions well, they can have that smile for a lifetime.
Okay, so we have time for these?
Yeah.
Let's take a look.
So this is a lady, she's a gorgeous lady, and she just had noticed that her teeth started to get a little short. And a lot of people will notice that. In their smile, they're like, hey, my teeth are shorter, and this is a prime example of that. And she came in and said, what can we do about my smile? And we did all the same things, making sure it, follows the lip line, making sure that the color's right, and making sure that we have symmetry across everything and lengthening them back to where she wanted. She was ecstatic, and she's a gorgeous lady, and she was so excited to have her new teeth.
So in this particular case, you did a kind of a combination of veneers and then the crowns that you make right there.
And yeah, we did some veneers. For her situation, we did the
Very
veneers
nice.
at the lab, and then we did some E4D crowns in the back.
I want to thank you for coming on the show. But final message, somebody watching this.
Yeah.
Maybe they're anxious about going to the dentist. They don't like their smile. What's your message to them?
My message is do something about it now. Come in when things are just getting, when they're small. They're so much easier to change our smile when we're just doing small things and we already have the foundation. And people are scared that they're going to come in and they're going to have this full mouth, reconstruction. Well, that happens sometimes, but catch it earlier.
So in Colorado, same-day crowns.
Yeah.
You want to own that part of the market.
Man, I want to be Colorado's same-day crown guy. Absolutely,
okay,
because it can change people's lives, and we can make people happier for sure. I want I want the people that are busy, who are busy business people that are like, I just can't take off that much time to go do this kind of stuff. I want them to come in and see, is this right for them?
Same-day crowns. Put the camera in their mouth, make the tooth. It's milled on this $150,000 machine, and they go home with beautiful teeth. Did I oversimplify it?
That's about it.
You
did it. You nailed it.
I want to thank you for coming to the show.
You.
Great stuff.
Yeah.
Great info. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go on our website at wellnesshour.com, put in Dr. Blatter, and you'll find him there, Dr. Blatter, or Colorado Dentist. You'll find him that way too. And for those of you on Twitter would like to say something nice about Dr. Blatter, you could put hashtag at The Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.